What is deep tissue massage? How does it work? Is it beneficial? And how do we avoid it being painful? In this video, we're going to look at those topics. So in anatomy, superficial and deep are descriptive terms. When we use the term superficial, we're talking about something being at the surface or closer to the surface of the body. The opposite would be deep. These are structures that lie underneath or deeper into the body. So when we use terms like deep tissue massage, we're not talking about a technique as such, we're more talking about an intent or approach, because we want to work down into the body to access deeper structures that may be dysfunctional or injured. Traditionally, deep tissue massage is associated with very heavy pressures and being quite painful, but that isn't necessary. The late great Leon Chaito had a great turn of phrase for this. He said, "Relaxed tissue is transparent to palpation." So palpation is to assess through touch. If tissue is relaxed, we can easily feel through it and assess the texture of the layer beneath. We could apply the converse and say that if muscle is tight, it is opaque to palpation. We can't really feel through it, and it's going to take a lot of force to try and work through it. So instead, if we want to work smart, we want to try and treat each layer as we go. If we start at the more superficial layers and we encounter some restriction, dysfunction, tissue texture abnormality, we want to spend a little bit of time there using techniques like pumping and stretching, myofascial technique, and soft tissue release. You can check out our other videos on these on our YouTube channel. And if we apply these techniques, we should be able to normalize the tissue texture at that layer. That grants us access to the next layer down without using excessive force, without straining ourselves, so we don't run the risk of getting repetitive strain or damaging our thumbs or wrists, and the client experiences far less pain. So not only is it a much more pleasant treatment approach, it actually is more effective because we're calming the nervous system, hydrating tissues, and normalizing the texture and function of the tissue at each layer as we go. Let's take a look at how these techniques are going to work in practice. When applying these principles to an area like the shoulder, we want to treat the superficial muscles so that we can access the deeper muscles. So in this case, I'm going to start off working on trapezius in order to relax and soften it, normalize tissue texture, and allow me access to the next layer down, whether that's the rhomboids or infraspinatus, or even deeper getting into the erector spinae, or deeper again into multifidus. The same principle is going to apply. Relaxed tissue is transparent to palpation, which means we can work through it, we can feel through it, and we don't need excessive force at any stage. That helps us to keep the intensity low, which calms the nervous system and stops the client from guarding, tensing their muscles, and pushing us out of the depth that we need to get to. So I'm going to start off by applying just a small amount of oil. Now when I'm applying a small amount, I mean literally a couple of drops. It's just enough to give us a little bit of glide, but we don't want to have too much oil on because then we will slip. We don't want to lose the ability to grip and move the tissues. So once I have the oil applied, particularly working in an area like the shoulder, I want to avoid bony areas. If I apply pressure to bony areas, we'll get unnecessary discomfort. We'll simply get tissue pinch. We're crushing the skin against bone. That's going to hurt and it has no therapeutic benefit. So I want to avoid that at all costs. So I'm going to have one hand below the spine of the scapula, the other hand above the spine of the scapula. I'm going to sink to depth, stretch the tissue, and then start moving. So this would be described as a myofascial technique, where I'm trying to move the fascia of the muscle. I'm dragging in towards the spine because this muscle is typically overstretched, weak, and inhibited. So to bring it back to its neutral position, I need to try to pull it back towards its origin, its fixed point, when it does most of its movement. Because this muscle is a scapular mover. Upper trapezius lifts the scapula, mid-traps pulls it back, and then lower trapezius pulls the shoulder down. So I'm working back towards this origin at the spine, hooking these tissues and drawing in. And I'm using a variety of applications, so I can use the palms of my hands, which is going to be quite broad, the backs of my fingers, and my finger pads. And I'm going to work this tissue until I feel like it has softened and relaxed. How do I know it's softened and relaxed? Well, I can feel through it and I can work through it. So the palms being quite broad are low intensity. Backs of the fingers are a smaller surface area, so the intensity is going to be a little bit greater. But I can compensate for that by changing my angle or slowing my pace. You'll notice when I work with my finger pads, I'm going to sink in, stretch the tissue, and I meet more resistance, so it automatically slows me down. I'm going to pay attention to that resistance in the tissue. If I try to force through that, either the intensity will go up or I'll start to lose my fascial hook, that grip on the tissue that allows me to move those muscles back. Now, if I encountered an area that was particularly tight or particularly tender, or it's really not softening, even after I've done quite a few myofascial techniques, I'm going to apply a pump. So I'm going to sink in until I feel the surface tension, the resistance at a certain layer within the tissue. And then I'm going to slowly compress and decompress. Now, when I press in, I'm pressing right up to that point of resistance. When I let go, all I'm really doing is backing off by 10 or 20%. I'm not actually letting go of the tissue completely. I'm not coming completely out of depth. So I'm compressing and releasing, compressing and releasing. And this does two things. It helps to hydrate the tissues because I'm creating a dynamic pump for the tissue fluid. So that helps to get in oxygen and nutrients. That really calms the muscle. It also helps to get rid of metabolites as well that may irritate our nervous system, our nerve endings. But it's also helping to hydrate the fascia. So the two primary things I'm doing is hydrating the fascia and calming the nervous system. The nervous system response is quite an interesting one. It's described as graded exposure. The nervous system recognizes that this is not painful and it starts to reduce tone or tension in the muscle. So the muscle softens more readily. Now, how I know I've pumped enough is I'll start to feel that the tissue softens. I oftentimes describe this as like a bicycle tire that's pumped to its fullest, is really rock solid. Tight muscle feels a little bit like that, particularly if it's adhered, if it's stuck, if there's knots. So as I pump, it's like somebody lets a little bit of air out of the tire, the muscle softens a little bit. Or sometimes I'll feel capillary refill, so as I let go, I'll actually feel the tissue plump up. I'll feel that refill come up to meet me as I ease back on my pressure. Once I've achieved that hydration, I'm going to stretch the tissue. So I'm going to move in multiple directions. And that feels a good bit softer, even after that short duration pumping. This really is a powerful technique, and its power is in its simplicity. It's not difficult to do, it just takes a little bit of time and a little bit of practice. Now I can work through that and I can more successfully access the deeper tissue. Now, the other thing that's going to contribute to depth, pressure is just one of the things. So a misconception around deep tissue massage is that it has to have very strong pressure. Not the case. Pressure does get us down to depth to a certain extent, but the surface area we use is going to influence that as well. It's very hard to press deep using a big surface area. Like a lot of people will use their elbow or something, and it's a big surface area. Your finger pads are actually going to go a lot deeper. So smaller surface areas are going to allow you deeper tissue access. Then the angle at which we work. So if I work at a low angle, I'm kind of skimming across the surface of the body. The more I increase the angle, the deeper I go into the tissue. And we've got to modify this. We've got to try and match the depth, the pressure, the angle, and the contact surface to get down to a layer that's still comfortable. How's the intensity on that, Ali?
About 3.
About a 3, so that's about right. Now, if she said a 5, I've got a couple of choices. I can either reduce, so I'm not going as deep, or I can pump at that level. Now, the pumping shouldn't be a 5. It should get less uncomfortable. There should be less intensity as we pump. So again, I'm maintaining a consistent angle. I'm down at the depth where I feel the resistance, and this is rhomboids. I can feel it from the fiber direction. That we can feel bands within the muscle that indicate the direction those muscle fibers are going in, and from our knowledge of anatomy, we can determine which muscle we're on. So once I've pumped, I'm going to stretch the tissue again, and I'm going to apply the same technique at exactly the same intensity, the same elements. I'm going to ask Ali, how's that feel?
It's reduced.
It's reduced. Okay, can you put a number on that? It's about a 1. So we've gone from a 3 to a 1. Now 3 is workable. I didn't have to pump there, but I just wanted to illustrate the point of how we can soften that tissue, make it more responsive without excessive force. I'm not breathing heavy, I'm not working too hard, I'm not causing excessive insult to the tissue, and I'm not causing any guarding. So this layer is relaxing nicely, and it's much, much more responsive to my techniques without me having to go heavy. Then I could work through that and I can start to feel the erector spinae. And we can feel a couple of tight bands there in erectors. So I'm going to do the same thing. I'm going to sink down to depth, meet that resistance in the tissue, and pump. And just for curiosity, what's the intensity like there, Ali?
Yeah, that's a good 3-4.
3-4, okay. So again, we could work it, but it's going to be more responsive and cause less discomfort if we pump these tissues first. So I'm literally just hooked in against the lateral edge of the erectors, And I'm pressing and releasing, pressing and releasing. And as I said, the release is really just a back off by about 20%. I'm not actually letting go. I'm not coming completely out of depth, but I'm going up to that point where it's at 3-4, easing back, letting it refill, pressing in again. And I'm continuing to do that. Rather than think in terms of time frames, like numbers of seconds, that's a useful guide. We could say 20 to 30 seconds, but really I'm going by tissue response. I want to see, when does the muscle start to soften? When do I feel that sensation of air being let out of the tire, that all the tissues are relaxing? Or the capillary refill effect. Now to me that feels like it's softened, so I'm just going to press at the same intensity. Can you put a number on that, Ali?
1.
It's a 1. So it's gone from 3-4 down to a 1, much more treatable. Let's give that tissue a little stretch. And now I could do other techniques, like I could do some muscle stripping, or I could do a little bit of cross fiber work, starting to tease apart any adhesion within those tissues. Or one of my favorites is I could hook into the tissue and just create a little bit of movement, just rocking the body, moving the rib cage so that the muscle moves rather than me frictioning over it. Far less likely to irritate the tissues and generally yields a quicker response. That's softening nicely already. So I'm going to go back to a little bit of muscle stripping. And anytime that I feel a really tight, stuck area, something that's not responding to my techniques, I can check intensity. A little tight there as well, Ali. How's that? What number would it be? 4. That's a 4. So we've gotten quite deep now. And again, I'm not using excessive force. I'm just using my fingers. I'm also using stacking of joints. So I've got a straight line from my contact surface through to my shoulders. So body weight is really doing most of the work. All my muscles are doing is acting as stabilizers for the joints. So I can pump. And again, I'm really monitoring tissue texture. So sometimes it can help to close your eyes. And the purpose of that is to just let go of visual distraction, so more of your attention can focus on your sense of touch, the haptic feedback we're getting through our fingers, and the response of the tissues that we're going to feel. We'll notice those changes quite quickly. That's softened again. What number would you put on that, Ali? 1. So again, we're going from 4s to 1s really, really quickly, really easily. And while it's not essential when it's only a 4, it does make treatment easier. I don't have to use excessive force, and it makes it more comfortable for Alison. And it also makes the tissue more responsive. So it's a win-win on every front. We're getting a greater tissue response in a shorter period of time without discomfort or without physical stress to the therapist. You can see why I'm quite passionate about this approach to deep tissue, that we're working our way down through each strata, each layer, from the superficial to the deep without ever using excessive force. So I'm not hurting myself, without excessive discomfort, so I'm not hurting the client. The nervous system is calmed and the tissues are more responsive. So we're getting a better result quicker. Really smart way to work. So I'd really encourage you to try out these techniques on your clients. This principle can be applied anywhere on the body. So this isn't limited to the shoulders. Treat at the layer of dysfunction that you find, rather than thinking, I need to get to a particular target muscle. If you encounter dysfunction, any kind of adhesion, any kind of really rock hard solidness, tissue that's unyielding, as Leon Chaito said, relaxed tissue is transparent to palpation. We can take the converse of that and say that tight tissue cannot really be felt through, and so cannot really be effectively worked through. So anywhere in the body you meet resistance, pump those tissues, give them a little bit of a stretch, get them to soften, become more pliable, and that will allow you easy access to the deeper tissues of the body. So as always, we hope you found this video useful and informative. Try these techniques out on your clients, let us know how you got on in the comments, and let us know if you have any questions or if there's things you'd like to see us cover in future. One favor we would ask though is to help us grow this channel. It would really help if you like this video, be sure and subscribe to the channel, and if you found it useful, why not share it with therapist friends of yours? Or if you go to a therapist that does heavy, painful, deep tissue massage, maybe think about sharing this video with them. Thanks for watching, guys, and we hope to see you again soon.